Okay.
Hello, my name is Lexi. I'm going to be your nurse today. Could you tell me your name and date of birth? Okay, so we have Bob Owens and 9/22/1933. I checked the identification band and it matches up. Do you have any allergies? Yes. Do morphine. Okay. So, today what we're going to be doing is we'll be administering IV medication for pain, the hydromorphone, through your PICC line. So, do you have any questions? No? Okay, so if this person did not understand, then I would have another nurse. If this was a pediatric patient, I would ensure that we would have their parent in the room or ensure that it's not going to hurt, okay? Because there's no needle stick. So I want to check my order. And we do, on my MAR, I can see that we have the order, and there's a central line that will do this hydromorphone through the PICC. She's currently on it because of chemotherapy. And so I did my math, and it went out to 0.5 milliliters. So what I want to go ahead and do is I want to ensure that I'm going to label my medication. So we have hydromorphone, 1 milligram. My math means 0.5 milligrams. The times is the 1200 and the date's 9/9/2020. And then I want to go ahead and I want to wash my hands. Then I'm going to assess our IV site today. So I checked in the Betty book for the hydromorphone, and I'm going to wash my hands. And there's no need for dilution for hydromorphone. And I'm going to provide for privacy. And I'm going to wash my hands and then don my gloves. We're going to give hydromorphone over 2 to 3 minutes. And the adverse reactions we would assess for would be respiration, blood pressure, vitals, dizziness. It's compatible with normal saline, and 0.5 milligrams is appropriate for hydromorphone, and it has not been given in the last 3 hours. So I washed my hands, I'm donning my gloves. Now I want to go ahead and assess the site for size and approximation. Do you feel any tenderness? No, there's no phlebitis, no infiltration, no dislodgement. Okay, good. So no redness or edema. So I'm going to go ahead, take off my gloves, and then I'm going to wash my hands. So next what I want to do is make sure I get a dose accurate. So we did the math, and it's 0.5 milliliters. So I'm going to we have 0.5 milliliters for our dose. Then I'm going to go ahead and get all of the air out of my saline flushes. And then I check the expiration date on my hydromorphone, it's good. And same with the saline flushes. Good. So we have 5 milliliters for our saline flushes. Now, what I'm going to do is I'm going to get dose accurate. So, I have my tape on here, and we have Bob Owens, allergies morphine. We have hydromorphone, 1 milligram IV push every 3 hours, PRN for pain. I can see that we have 0.5, which is our 1 milligram. And then has not been given the last 3 hours, and I checked the expiration date. So we have Bob Owens, allergies would be morphine, and then we have hydromorphone 1 milligram, which is 0.5 milliliters. IV push every 3 hours PRN for pain, and then it has not been given in the last 3 hours. So we have Bob Owens, allergies is morphine, and then we have hydromorphone 1 milligram, which is 0.5 milliliters. IV push every 3 hours PRN for pain, and then it has not been given in the last 3 hours, and I checked the expiration date, and we're good on that. So what I want to go ahead and do is I want to wash my hands, and then I would don my gloves. Because I assess the site, and then what I want to do is I want to clamp or unclamp the IV site, but our IV site does not have, the PICC line does not need to be clamped. And then another thing is if there was a heparin flush, then I would go ahead and get the heparin out of the IV because it's held for patency, because we don't want the heparin combined with the hydromorphone. And then as soon as we are done, then we would put the heparin back in to remain patent. And then our medication is due now. I got all the air out. So first, what I want to go ahead and do is unclamp the site, and then I want to assess for the respirations, the blood pressure, test for respiratory depression. I want to ensure that the patient's doing okay. And I want to check for fatigue or dizziness. Do you have any fatigue or dizziness? No. So we're going to give our saline flush. So I'm going to go ahead and I'm going to swab the alcohol site. You're telling me if you have any allergies? None? Okay, and I confirmed her name and date of birth, and then her wristband once again. And then what I want to do is allow that to dry. So I would do the alcohol wipe for 10 to 30 seconds. And then for my first saline flush, it's 5 milliliters. So I'm going to go ahead and inject. And then what I want to do is discard the syringe, and then I want to take my next alcohol swab, go for 15 to 30 seconds, allow that to dry. So now we have our hydromorphone, and what we want to do is assess for adverse reactions, and we want to do this over 2 to 3 minutes. So I cleanse the site with the alcohol, allowed it to dry. So for time's sake, we're going to say that we did this over 2 to 3 minutes. And then I'm going to say that we assess for adverse reactions. So respiratory depression, blood pressure, dizziness, fatigue. And then I'll discard my hydromorphone. And then I would take another alcohol swab. And for the saline flush, we're also going to go over 2 to 3 minutes. 15 to 30 seconds, the alcohol swab, and then allow it to dry. And then next, we're going to do this over 2 to 3 minutes as well. Our next saline flush, 5 milliliters. So for time's sake, I'm going to say we did this over 2 to 3 minutes. And then I would go ahead and dispose of my syringe, and then take another alcohol swab for 15 to 30 seconds, and then allow that to dry. And then for our last saline flush, what I want to do is I want to plunge it. So it's going to be little tiny increments. Pulse. You pulse the last one. So we'll go ahead and say we pulsed all of the normal saline, dispose of the syringe, and then do the alcohol, wipe for 15 to 30 seconds, and allow that to dry. And if there was a cap that was antimicrobial, I'd put that over the top. And what I would do if there was a clamp is I would clamp the PICC line. And then what I want to go ahead and do is take off my gloves, wash my hands, and then I want to continue to monitor for adverse reactions. So what I would monitor for would be for the respiratory rate, and then I would monitor for low blood pressure, respiratory depression, any fatigue, do you have any dizziness, ensure that my patient is in a locked position and safe and low locked position. And then I would go ahead and dispose of my supplies, and then I dispose of the sharps in the sharps container if I had any, and then I would document my findings. So what I would document would be what I use. So I use hydromorphone, 1 milligram or 0.5 milliliters, and then I would document how the patient tolerated the procedure, how all the assessments that I did, so any adverse reactions, so respiratory rate, blood pressure, vitals, fatigue. I would also document the time and the date, my initials, and then I would document, and then I would wash my hands, and then I would go ahead and document patient tolerated procedure, start time, the IV site. So I would also document the IV site, if there were any redness, if it was well approximated, the size, and we did not see any of that today. And then the amount of hydromorphone, which I already had said, and then start time, so it's 1200, and then the date, and then how the patient tolerated procedure, so very well, and then I already disposed of my supplies, and I'll wash my hands, and then I'm done with the skill.